Hello, viewer. Thank you for joining us once again on this particular show, Adolescent and Youth SRHR digital platform, where we get to discuss matters sexual and reproductive health. So today we have a guest on board, and his name is Kenneth Bundi Miriti, and he's the Director of Reproductive Health, Kilifi County Government. Let me add him to the stream. Welcome to the studio, Kenneth.
Thank you.
All right. We also have on board a sign interpreter. His name is Harrison, and he's also here to also introduce himself and also just do the sign interpretation. All right. So welcome to the studio, Harrison.
Okay, thank you.
All right. So to start off, I'd like you to introduce yourself, Director Kenneth, and after that, Harrison is going to introduce himself a little bit, and then now we can start off the live discussion.
Thank you very much, Violet. My name is Kenneth Miriti. I'm not the director. I'm the coordinator of reproductive, maternal and child and adolescent health in Kilifi. So that is basically my title, Reproductive Health Coordinator, Kilifi County. Thank you.
All right. Harrison, kindly introduce yourself so that the viewer may also get to learn more about you.
Okay, my name is Harrison Nyaga from Kilifi County. I'm a sign language interpreter.
Welcome, welcome. So, Mr. Kenneth, kindly share with us about your reproductive health work in Kilifi County government, and so that the viewer may get to learn more about what you do.
Thank you. So, first and foremost, I want to thank you very much for bringing me into this platform. My core responsibility is the reproductive health, and that involves maternal health. I'm talking about issues to do with the delivery of babies, the antenatal care for mothers, family planning services for the general population and the adolescent sexual reproductive health program, and also child health. So those are the programs I coordinate together with other program persons within the CHMT in Kilifi County. Thank you. Violet.
All right. So, yes. So we've heard that there are so many that teenage pregnancy is on the rise, and it keeps on being on the rise in Kilifi County. Is that true? And if not, what is the county government doing about it?
Yeah, so I would say it's not true that it keeps rising, and I'm supported by the figures. In 2018, as you can remember, Kilifi County was one of the counties that had a very high burden of teenage pregnancies. We were reporting that 3% of all the mothers that come to our facilities as being adolescents. And so the following year, that is 2019, okay, in 2018, various efforts were put, and you can remember the governor launched the AYP strategy for Kilifi, sometimes in May in 2019. He also launched a task force on teenage pregnancies that involved the three departments: the Department of Gender, Department of Health, and Department of Education within the county. And we also engraved in the Ministry of Education within the county, and we came up with various strategies, so that in 2019. At the end of the 2019, we had gone down from that 3% to 19.2% of in teenage pregnancies. And then in 2020, which has been a very hard year for us, we have also reduced the numbers from 19.2 to 16.2% of all the mothers that come to our health facilities. 16.2 only are adolescents. And when I say only, I don't mean that it is a normal it is normal for us to have adolescents becoming pregnant. But comparing to our peers, the other counties, we are doing very much well. I know there are news circulating from the Minister of Education about around 900 girls who are said, I don't know whether it's 900 or thereabout, who are said to be pregnant. That is a part of the 6,000 that are pregnant within the county. But remember, looking at data from yesteryears, we can say we have made great strides as a county in the reduction of teenage pregnancies. Yes, Violet?
All right. And the other thing I'd also like to you to talk about is youth-friendly centers. Are they available in Kilifi County? Because adolescents and youth, they usually state that they can't access services at the sexual reproductive health facilities that are being run by the government, because the people who are there are like the same age as their mom. So they don't have like young people who are manning those particular desks at the various public hospitals. So I just wanted to know, for you to expound on what you are doing as Kilifi County government to address this issue.
Yeah, so I want to say this, Violet. One thing that we need to understand is youth-friendly services, and this comes from research from various people. We have Chandra, we have various other people within the space of AYSRH have shown that standalone youth-friendly centers do not work. Actually, with if you look at the data that was collected recently by the young people within Kilifi, when you are launching the youth centers I'm going to mention here, you realize that most of the young people preferred going to health facilities to seek services there, as opposed to going to a center to seek for services. But that said, we have as a county been able to give commitment in the last 1 year of establishing at least 4 youth centers, and 3 are already functional. That is the Matsangoni one, the Mtwapa one, and the Rabai one. They are already functional in the sense that we have been able to equip those youth centers. We are continuously taking equipment there, and very soon the Matsangoni Youth Center and Rabai Youth Center will be fully functional. The Mtwapa one has already been launched in a very pomp and colorful celebration that was done in the beginning of the year. Actually, at the end of the year, 2020, we were able to launch the Mtwapa Youth Center, which is actually a youth center of its own in terms of the services we offer there. We have a first-time young mothers clinic there that has been able to recruit more than 200 young mothers. We are talking about these teenage pregnancies, and then these mothers, we don't know where they go. So the Mtwapa Youth Center has been able to establish a service for these young mothers, so that when they come there, they get the services from a youth-friendly perspective, and they are also able to be supplied with the mama packs and baby packs that sustain them, because, as you know, some of these women, young girls and young women who get pregnant, are not able to cater for their babies also. So the Mtwapa Youth Center and the young mothers, I mean the first time young mothers program, is stationed within the Mtwapa Youth Center, which we have re-established recently in Mtwapa. Then we want to do the same in Rabai Health Center, where we have a youth center that we have renovated through the help of World Bank and the county government, and another one in Matsangoni, in Kilifi South, in Kilifi North, where we have also re-established another youth space that we are going to network. The uniqueness of these youth centers, and I've not mentioned also the Malindi one, which we are relocating to Muyeye Health Center because of the problems with COVID. The space that we were given in Malindi was taken up by the COVID as a COVID isolation. So we are moving this to Muyeye Health Center to have the 4th youth center within the county. So for this financial year alone, we'll establish 2 youth centers, one in Muyeye Health Center and another one in Kilifi County Hospital. So in total, we'll be having around 6 youth centers within the county. And the uniqueness, as I was saying, is that we want to network these youth centers with high-speed internet connection, so that for example, if you're having a session in Rabai, the youth in Mtwapa can follow it in a smart TV through the internet. So we are equipping them with the smart TVs and the high-speed internet connection from Safaricom to be able to network all of those youth centers, so that we have networking within the county for the young people. Something that we are also doing about these youth centers is to ensure that we have a concept and also a TOR that will help in sustainability of these youth centers. So eventually, Kilifi County will, at the end of 2021, we will have at least 6 operational youth centers.
Great, great, great. So viewer, if you have not yet subscribed to this YouTube channel, kindly go ahead and subscribe. It's Adolescent Youth SRHR digital platform. Follow us also on Facebook at Adolescent Youth SRHR. On Twitter, we are at Adolescent Youth 1. And on Instagram, we are also on Adolescent Youth SRHR. So even this video will also be uploaded on our Instagram TV, so that any person who's on Instagram can also watch this show. So the next question that I have for you is matters family planning supplies. Are they available at the various health centers? Because some of the reason even behind the high increase also of teenage pregnancy or even unintended pregnancy is because when women and girls go to the health facilities, they don't find they don't find condoms, they don't find P2s, they don't find even the implants. So I'd like you to talk about the status of the family planning supplies in Kilifi County.
Thank you very much, Violet. Our commodity status is stable. That's what I would say. We have a very elaborate system of monitoring our commodity security within the county, and I'm talking about the family planning commodities. So previously, we have been having we have had a manual way of follow-up of these commodities, but currently, all the facilities, all our 144 facilities, are equipped with gadgets to be able to report to us on a real-time basis on commodity security. And I can tell you that for now, we have, if you look at the platform for commodities, we have a stock of at least 3 months for the county. That means no facility should be able to say that they are not able to give any of the methods of family planning, because those methods are there. We have enough for our public facilities. So clients, the young people, the general population should be aware that we have all these commodities available within our facilities currently.
All right. And adolescents and youth have been in advocacy spaces. They have been stating that they are not at the decision-making table, like being in technical working groups. That have been initiated by the county governments. So I wanted to ask, have you engaged adolescents and youth in the working groups in Kilifi County, and which working groups are they in?
Yeah, specifically the young people have given us big boosts as members of the technical working groups. The Adolescent and Youth Sexual Reproductive Health Technical Working Group comprises of young people. Majority of the organizations there comprises of youth-led organizations. And then family planning family planning technical working group also comprises of so many young people-led organizations, CSOs, and what have you. So what I would say is for Kilifi County, it's unique in the sense that if you look at the agitation, advocacy for more funding for reproductive health, Kilifi County is actually the advocacy is led by young people. So what I'm saying in a nutshell is we have engaged young people in each and every stage of ensuring that they take part in decision making. They take part also in programming. For example, we have a family planning program implementation team meeting every month, where we have at least 2 members of the Youth Advisory Council joining us for those meetings. So you can see the level at which we have moved, and we have also moved to also ensure that in this in the coming months, we are also going to support the Youth Advisory Council to take a leading role in ensuring that they are able to understand what we are doing in the county. They are also able to take part in program management, actually program implementation for reproductive health, including for adolescents.
All right. So I'd like you to take this opportunity to also share the challenges that you have faced as the department, and what have you done to overcome those challenges?
Yeah, challenges are many, Violet, but we are placed where we are placed to ensure that we overcome the challenges. The biggest challenge of all times is the COVID-19 pandemic, which has weighed down on us so much in terms of service provision, in terms of ensuring that we give services in the normal way and also in an abnormal manner. Remember, reproductive health services are services that need a lot of contact between clients and healthcare providers. So we have had this period where we had a situation where healthcare providers were fearing to get infected. Clients were fearing to get infected in hospitals. So eventually we had a situation where some of our educators went down. The other big challenge that is facing us, and not only us, all the counties, is to do with human resource for health, where one, we don't have enough staff, and two, we have a problem with industrial action. Like now, currently, most of the facilities are closed because of the current industrial action. So that also weighs down on the gains that we have been able to make over the years, because people would like to seek for services, but they are not able to get the services because healthcare providers are not in the facilities. So that's another area that we also need to that I would also mention as a challenge. And the other challenge is to do with social-cultural issues that are beyond the healthcare provision spectrum. For example, there are these issues, there are these cultural issues that we are not able to control at departmental level. They are deeply entrenched within the communities. We can only live with them. A case in point is issues of child marriage among some religious groups. Some of these things, some of these kind of issues, we may not be able to handle or to fight outright because of the issues, the religious issues that attach to them. Otherwise, I would say the county government of Kilifi has invested a lot in reproductive health. It has invested a lot actually in adolescent sexual reproductive health. This is I think a 2-year program. It was just established the other day, and it has seen a lot of gains in terms of the programming and also giving of services to adolescents.
Yeah, you have stated that you have seen a major wins. Kindly
Yes.
elaborate on the wins that you have that has been generated because of the 2-year program. And the 2-year program, when did it start? Yeah.
Yeah, so this program started in 2019 in July. That's when it was actually given I was the first coordinator of the adolescent sexual reproductive health within the county in June 2019. And by that time, the county had allocated only 1.3 million shillings for for the adolescent program. But over the years, over the last 2.5 years, we have seen this increase from 1.5 to around almost 7.2 million. And if you look at the round figure budget in terms of what is going on with the implementation of the AYP strategy, the implementation of activities that are youth related, the budget is even immense. It is beyond even that million in terms of if you quantify everything that is happening among the partners, the county government, etc. So we have had a big win, and this can be elaborated using various things that we have done. For example, in 2019, as I said, we developed the AIP strategy, which we have since revised last year to have a strategy of an adolescent strategy for Kilifi for 2020-2025. And currently it is costed, and we are also putting it into a domain so that the partners who work within Kilifi County are able to feed into the dashboard and be able to see how much is being implemented by all partners, including the county government. Then the other thing that we have done is we were able to do various other activities. For example, the symposium, the adolescent symposium in Kwale, which was very successful. This was for Kilifi County to be able to showcase what we are doing and also help the other counties around us to follow the same examples that we are doing. And from that symposium came a request from the county. Of course, we have done it through the Jumuiya Counties of Pwani for technical assistance for all the counties within the coastal region to be able to for them to be able to match up with Mombasa and Kilifi counties, which are doing very well in adolescent programming. And this technical assistance has already passed through in WHO. We are already looking forward to working with WHO to ensure that all the other counties, Lamu, Taita Taveta, Kwale, and Tana River, join us in having a robust adolescent and youth programs. Apart from that, last year we did something unique. We were able to come up with the first ever e-magazine for the Youth Advisory Champions for Health. And this was launched last year by the CEC of Health at around May. So those are quick wins for us. And the other thing that we have also been able to do very successfully was the last year's World Contraception Day. We did a very unique celebration of the World Contraception Day within COVID-19 period, so that all the sub-counties were able to showcase what they are doing. The young people, youth-led organizations were brought on board to showcase what they are doing, and it was a real feat that we look forward to documenting. So over and above that, if you look at what we are planning to do, I've mentioned about networking of the youth centers so that we have hubs where young people can get information. Like, for example, this interview, they can follow it from the youth centers through YouTube, and because we have internet connectivity. We are also establishing a domain, as I said, for the adolescent, not only for the adolescent program, but also for all the RMNCH programs. We are talking about all the RH programs, so that partners, anybody who wants to see what is happening in Kilifi will be able to log in and be able to see what is happening. And then partners will also be able to feed into this domain and be able to actually aggregate what is happening, in what people are contributing towards the implementation of the AYP strategy for Kilifi. So that and much more is what is actually what we have actually been able to win. Not to forget to mention the reduction of teenage pregnancies from that 3% in 2018 to 16.2 in 2020. Thank you.
Wow, awesome. So we are coming to the end of the broadcast. Viewer, if you have any question, kindly type in the comment section, and we'll be able to ask Mr. Kenneth so that he can expound more. So what message do you have for an adolescent and youth who's watching this particular show, not only in Kilifi County, but also across Kenya?
Yeah, what I want to tell adolescents first of all is the right to reproductive health, and this is to all young people. The right to reproductive health is enshrined in the Constitution. By the way, our Constitution was very keen on reproductive health. We mentioned about health. Health is a fundamental right for all people in Kenya, including reproductive health. And so it is upon young people to come and seek for these services in our health facilities. People may say, for example, when you talk of reproductive health, people may think that we encourage young people to indulge in sex, for example, early. But for those, we know very well that there are young girls and boys who have already started indulging in sex. So those who have started indulging in sexual activities need to seek for services from health facilities to keep safe. For those who have not, I encourage them to continue abstaining and wait until when time is nigh for them to indulge in sexual activities. And for the girls who become pregnant, it is not the end of life. For us in Kilifi, we are creating programs not only for the adolescent girls who become pregnant, but also for their babies, because we may talk about the mother so much and forget about these babies who will also eventually become young girls and boys who need to be taken care of. And I encourage young people to take life very serious, especially those who are in school, to take life very serious, to study very hard, and to follow the right role models, so that we can have a generation with future hope for the parents who are emerging. Thank you very much.
Oh, thank you, thank you. And thank you, sir, for the insightful feedback and even the message to adolescents and youth. So I want to say thank you to you for gracing the set. I also want to say thank you to the interpreter, Harrison, for gracing the set. So by the way, Mr. Miriti, if you need services of a sign interpreter from Kilifi County, Harrison is there to offer his services, because he had informed me earlier that he also does community engagements and more so working with adolescents and youth.
Okay. We'll surely engage with Harrison to ensure that he also gets into the system. And by the way, we are doing Harrison as representing the people living with disabilities. This year, we are also doing something for disability for people living with disability in RMNCH. So what we are doing is we are bringing healthcare providers to be responsive to people living with disabilities. That is something we are calling disability mainstreaming in RMNCH. So very soon we'll be engaging with them to ensure that they are on board. And Harrison, being an interpreter, then he comes on board handy.
All right. So Harrison, you can pass by Mr. Miriti's office. You just say hello, so that at least now you can have a one-on-one meeting, and then now from there, all of you will know what will transpire after that. But Harrison is our resident interpreter. So when we are having our live show, he's the one who's going to be interpreting for the persons with disabilities who are not able to hear.
Okay.
So thank you. Thank you, viewer, for joining this particular platform. Join me next time, even as we bring on board an amazing guest. Asante.